Hey guys, so this is something new that we're going to be doing for our content. We're going to be doing some reaction videos, and there has been some news earlier this year about a really famous League of Legends player retiring. His name is Uzi, and there was a lot of content, or there was a video specifically, an interview released by him that we wanted to react to, first of all, and also maybe provide some of our thoughts as to why we have some concerns about how his health may have been managed over the course of his career, and maybe there are other things that could have been done, and also maybe answer the question of can he ever return?
And to be clear, the reason that we're doing like a reaction video here is so we'd already, Matt and I obviously know who Uzi is. We chatted about his injuries when they cropped up, time off when it cropped up. But the reason we're specifically doing a reaction video was Matt had asked me if I'd seen the video yet and what my response was, and I was like, no, why? And he's like, all right, we're watching this. So apparently I'm watching it live for the first time with you guys. Hope you enjoy.
So here we go. We're switching over to the video now,
All right, all right.
and let's see.
God, June 1st feels like so long ago at this point.
I know, right?
How is it only a month? It's been 6 years since then, obviously.
That's true. It's been a while.
It's been a really long June.
Get rid of this ad. There we go.
There we go. Hi, cat. My cat is saying hello on the reaction video as well.
Nice. Mechanical genius.
Yes, cats are well. All right, that's like not a bad idea. Start like thinking ahead of time when you're noticing, starting to. What? Matt, please. What? Please pause.
All right.
The fuck was that? Go back. Is that literally the reason you wanted me to watch this video for that?
Okay. Let's pause here, everyone. What is happening? Who is this guy?
I don't know what that is.
And why does he feel the need to offload to show him what I'm assuming to be cueing him to help him understand a little better about his posture? That's not necessary ever.
That's a really generous assumption, Matt, because that's not what I'm getting at.
Okay, then maybe I might be giving him a lot of credit. What are you thinking about this? What's happening here?
Honestly, it looks a lot like the kind of rigging we'd use for getting a dependent patient out of bed. He'd use that as that's clearly not a pulley system because you can see handles behind him. I could maybe see it be something like an active assisted range of motion, doing like pulley motions like this to work on range of motion, but
but how he's using it.
It's not how you. I have no idea how they're using this or what they're using this for, but it doesn't make any sense whatsoever other than this is a large piece of equipment. Let me show it on this very serious video about my health.
Exactly. That's all I can think of as to why. And maybe even, hey, we really don't know what we're doing.
Big pieces of equipment we're using right now. We could have broken out like stim machines. We could have therapists involved. We could have had I don't know, it's totally bullshit science at this point. We could have even had an ultrasound, and that would have been better than this.
Exactly. I definitely think this is a function of, hey, like we have this equipment here. It makes it seem like we know what we're doing. But
it's that 70-20-10 rule. Like 70% of performance is the basics. It's healthy exercise, healthy nutrition, adequate sleep, good hydration, all of that jazz. Same thing goes for medicine. 70% of what we do is the basics. And yeah, there's really cool and fancy equipment that we can get. And there are times even when that cool and fancy equipment is part of the basics. Like if we were treating spinal cord injury patients, then equipment that helps them get up and walking, while it might be like over the top fancy for other people, makes perfect sense for them. But like 70% of all of that recovery, all of that performance is basic, simple stuff. This is neither basic nor simple nor fixing anything.
Exactly. Unfortunate that we're seeing this.
So all right, we're off to a great start.
Let's
carry on.
Okay.
I wonder if he means type 1. Oh, nope. He's saying he's having to take something now, which suggests that it's type 2.
Yep.
Type 2 is really manageable.
Mm-hmm.
I mean, it's if you're feeling like you don't sleep enough and like you can't eat after taking your medication, then you should maybe talk to your doctor about being on a different medication with fewer side effects or less impactful side effects. And I mean, all right, hold on. Please pause that.
Whoa! Okay, so there's more.
Go back.
There's more.
Go back.
Right? So what are we seeing? We're seeing that he's now using this contraption to pull downwards or just move outwards slightly.
All right, so I can actually see what they're doing there, and that one I find a little more credible because that looks kind of like you've seen TRX bands before, right?
Yes.
Like the TRX straps. It looks like somebody doing like basically an iron cross TRX straps.
So
that one would actually work on shoulder stability. This is less bullshit.
Okay, but there's also actually that could be beneficial too. So he has a strap around his waist that might be killing him.
Yeah.
Right. Okay.
This is a less bullshit use of this piece of equipment.
Exactly. So there is some potential benefit here. But I think something that is really important to understand is like, what is he being told through all of this?
Right.
Right? What does he understand is the purpose of this? Because his beliefs can really make a large impact as to his decision down the line of,
we talked about like before.
Yeah.
Like, kind of like the ways that you start to think about your injury and your body, and kind of its chronicity. And I think one of the downsides of a big and cool piece of equipment like this is it does suggest a really severe level of injury.
Exactly.
And I mean, even the exercises that he appears to be doing, the stabilization he appears to be working on, you could do this in a variety of different ways, most of which wouldn't put you in a position where you're at risk of falling if you lose control of your body weight. Like, there are plenty of ways to work on scapular stability, on horizontal abduction strength, that wouldn't require you to be strapped into a system that keeps you from falling over if you lose control of your shoulders.
So I totally agree there, right? Like, they totally underestimate the perception of this large contraption and how it affects his belief in how severe this case is, right? If it was as simple as, I just need to do a couple exercises here and there on a regular basis, then he might not think that it's something that is irreversible. But because of it's something that's so big with all these orange weird contraptions, it definitely can impact and create those thought viruses for him. But I think we should also touch back on the diabetes comment that you made, right?
So I was saying, like, if you're on a medication and you're taking that medication and your side effects are so severe afterwards that you're tired for a full day, you're not sleeping well, and you're having trouble eating after you've taken it, one, you want to pay attention to whether or not those symptoms only happened after you started taking the medication. And two, if they did only start happening after you started taking the medication, then talk to your doctor, because it's probably not the right medication or the right dosage. You might need to, especially with chronic illnesses like that, there is some trial and error in finding the right dosage. Same thing goes for mental health conditions like depression and anxiety. There is a really large variety of medications out there because different people have really significantly different reactions to different medications. And yes, under the US medical system, it can be a little bit tougher to ask for that because sometimes your insurance company will cover one medication to a greater extent than another. And I'm not going to get into that in this particular video, but like, if you're having really severe side effects from your medication, that's a thing you tell your doctor and they can probably sort it out if they can't find a new doctor, or at least talk to a new doctor about, hey, can I get a second opinion on should I be having these side effects from this medication and are they at all avoidable?
Right, and I think we also need to get more clues as to, hey, what are the other potential reasons that might be leading to him feeling this way in the first place? Is it a result of the medication, as you said, or is it once you started taking it, then you began to feel it? So maybe throughout the rest of the video, he might give us some clues as to, is it after the medication or is it just practice?
That's the video you're going to be giving me. I'm going to get more clues to this.
I don't know. Actually, I haven't seen this specific one. I've seen the cut up one. So
all right, let's go on.
Let's keep going. So we see this, and he's massaging.
Okay. If you're going to be working on someone's cervical and or thoracic spine, you're not going to have them in massive amounts of shoulder flexion because one, you're making it so that they can't really relax. Two, you can't really get at this, like, especially at the cervicothoracic junction all that well when you're engaging all of those muscles that surround that area. Put your arms by your sides. This is how we get you the natural curvature of your spine. Also, put your face in a face hole and not turn to the side.
Yep. So
get a massage.
There was definitely very little depth in his palpation here. You know.
Yeah.
Very. I mean, hey, could have just been for the content. Could have just been for the content. Could you massage?
Yep. All right. I accept this possibility. His foot. That could be a diabetic neuropathy kind of thing going on.
Well, yeah.
That's the kind of thing that, like, and you can keep playing this, but like that's the kind of thing that can happen when you don't address your diabetes early. The other thing we should note is we're assuming that he's got diabetes type 2 because he said he started taking this medication recently. Type 2 is a diabetes you develop as opposed to the kind that you're born with, which is type 1. Type 2 is both preventable and manageable with nutrition and exercise changes. You can stop having type 2 diabetes. Not everybody, to be clear, but in addition to medication, there are lifestyle management changes you can make that have a really significant impact on how severe things are, / if you continue dealing with diabetes at all.
Yeah, exactly. If we go back, actually, you can kind of tell that in how he...
Yeah, it feels like I did better than things I could have done better in.
Yeah, it feel like how he's communicating too. He has the belief that it's done for him.
Yeah.
You know, and I really feel like that's impacted by who he's spoken to.
Absolutely. Like, he was a professional really shape what your patient thinks about not just their injury, but their overall health. Like, he seems kind of fatalistically resigned almost.
Right, yeah.
Like a lot of...
I'm done. I don't have time to do this. There's no way I can return, it seems like.
But, like, he's still young.
He's 23.
Yeah, he's a baby.
He's so young.
He's a bambino.
And no joke, right? Both of us have gone through so many cases, 3+, 6+, 8+ years dealing with chronic pain, and we've gotten them to play full volume of play. One specifically with Overwatch.
Okay, so that was something really important, that your psychological state is going to affect how far you continue in your career, and he's absolutely right. Which is like why I think it's been so important that so many orgs have been. You can keep playing it. Have been like starting to implement like mental health and mental skills and mental toughness work into their curriculums, and it makes a huge difference because, I mean, that's what we've been talking about here. That it's not just your physical function; it's how you think about your physical function and your performance. And like, there's definitely a point where even like a really, really good player might become like just disheartened and can't deal with it anymore. Both the travel, the pressure, all of the aspects of competing. Like there are really good players who've stepped down in their prime because they weren't physically injured, but because they're just like, nah, I can't anymore. It's happened recently in Dota. Somebody stepped down basically because he didn't love and enjoy the game anymore. And that's totally valid. But it's also really clear that, you know, how you think about your experience really impacts your desire to continue with it. Alright, here's the part where I plug Dota 2 again because it's clearly superior to League. Don't kill people, I'm kidding. I like both games equally. You're all my favorite children. I totally get that. Also, there's an ad that's about to start, so we'll have to pause and cut that out of the video.
Yeah, we'll cut this out. Okay.
I totally get like that excitement about like getting things mechanically correct. That's the thing that I feel like when I'm raiding a lot. Normally I run healer, but most recently I've been running as a Deadeye, which is like a thief class in Guild Wars, and there's a very specific mechanic that you have to learn for one particular raid. That it's the first time I've ever felt like I understood the mechanics so well that I was able to adapt when things went wrong, and like I was able to cover for somebody else's mistake, which really feels like I truly understand it at that point. And like that moment of like totally having like the mechanical and the technical knowledge and awareness is just the absolute best feeling. I totally
Exactly.
understand what you're talking about.
And that's why I love playing competitive games at, more or less a really high level, just because I love
Right.
that, basically that dopamine boost.
Yeah, it's absolutely just dopamine rush of like,
Yeah.
I got this.
Yeah.
I got this.
Yep. Yep. It's almost like getting into that flow state and really feeling
Yeah.
all of it coming together.
That perfect balance of like stress and calm.
Yep. Yep.
Because we need both.
2018年的时候，你让我现在回想起那一年，我那一年我都不觉得我自己是真正的是一个那么好的自己吧。对，我没有想过真的那一年。
This part is really important, and actually,
Okay.
I remember we spoke about this during our Red Bull roundtable in terms of self-efficacy, right? And again, coming back to how beliefs impact how they believe they're capable of performing or capable of doing what they're doing in their own respective sport. And for him, because he started to have this lack of self-care around his health that led to these injuries, it really led, and potentially seeing these healthcare professionals that told him things that impacted how he believed he could move forward, it made him question his ability to play.
I can also definitely see like how that's a self-perpetuating cycle too, because you're not playing well and you're having pain and you're like, I don't have time to deal with this pain. I need to get better at my playing. So you neglect the pain, which is a thing that's constantly in the back of your mind, both in terms of, am I going to be okay? Am I going to be able to keep playing? And also in terms of your body needs to basically expend energy to manage that pain and focus on your playing while you're trying to play.
And I think it's even worse for him, right? Because he is, at the time, regarded as one of the best in the world, so he has expectations, right? And that balance with the stress of someone telling him that he can't, that it's a no.
Right.
Those two colliding, right? Probably stressed him out so much, and really led to what he said there. It didn't feel like a me. It didn't feel like the right me.
Yeah.
And even so, I know that he still performed quite well.
Right. It's not as though he performed badly. He just didn't perform as amazingly well. And it's just really good tea. I got this really delicious new like Assam tea that I'm in love with right now.
Nice. I always go with my regular jasmine green tea.
I do have green tea as well. I got a decaf green tea recently because I've been really loving green tea in the evening. But I would also like to, fall asleep at a reasonable time. And by reasonable, I mean like midnight. Because I'm...
Yeah, right. I know that there was some news about him taking a break. I'm wondering if they're going to get to that.
Yeah.
Or if they're going to even discuss any of the
schedule,
right? Schedule and how those things might have impacted it. And that almost like makes it help us understand better like what's important to the meta in Asia, right? Like, oh, they don't really focus on those kind of factors yet. Those aren't really that important, or they don't recognize those as the contributing factors for why he might be retiring. They're not focusing on that.
So he said for Season 8 Worlds, I don't want to talk about it because we lost because we were mechanically inferior. And yes, that's part of it, but there's so much more that goes into losing a game than just who's got the better mechanical skill. There's the draft, there's how you feel pain-wise, how you feel mentally in terms of like your ability to compete, the pressure you've placed on yourself or the lack thereof. That's one of the reasons we talk about that flow state, the balance between stress and calm. We played ourselves. That's a really important way of considering it, because if you're in your head about all of this, if you're thinking, we've totally got this and are feeling super confident and not considering, the potential downfalls of that. And at the same time thinking, being super stressed, we have all this pressure to live up to. Can we possibly win it? Both of those are really kind of, they're not eustress in that they're like a positive stressor. They're that negative kind of noxious stress that you really need to work on very particular types of mental toughness and even teamwork and communication to balance out. because that's what's going to help counterbalance those really stressful moments, not just how you in your head are thinking about it, but how all the people around you are thinking about it.
Yeah, and that's the complexity of higher level esports and just how unique and interesting it is.
Yeah, everyone might have been under a lot of everybody had a phobia for the important games. Yeah, that attitude. I don't want to say that's like a self-fulfilling prophecy, because that isn't the entirety of it. But a big part of in-game performance, both in traditional sports and in esports, is related to like how you mentally approach the game. That's why there's an entire book, The Mental Game of Tennis. There is a whole industry of books and education out there about mental skills training, mental toughness. It's no replacement for mechanical skill or strategy, but it does absolutely supplement those things in a really irreplaceable way. All right, Uzi, come on. What 16-year-old doesn't know how to use their cell phone? What are we talking about here? That is a good point, though. The kind of social and community pressure.
Right. Especially in the Asia communities, too.
Yeah.
Right?
It reminds me of like, pardon the political analogy here, but like, it reminds me of the reason that I hate Super Tuesday. Because it has to do with like the belief in momentum, right? Like, we had candidates who were running for office who, by the time my state actually got to vote in the primary, they were already out of the running, essentially, because other people had been perceived to have momentum or not have momentum when like half the country hadn't even got to vote on it yet. Same thing for these players, especially the young ones coming in. If the community perceives someone as being great, but then too cocky or not great and never going to make it, that constant reinforcement in messaging can really affect how that player feels about their ability to play. And yeah, sure, there are some people who are able to tune that out, and that's great. But there are a lot of kids, really. These are kids. They're teenagers who have never experienced or been exposed to anything like that. And that's absolutely going to impact about their ability to go on and continue playing, or their desire to continue playing. Oh, it's clearly involved fireworks. Everybody's retirement ceremony should involve fireworks. Just please don't set them off yourself, because that's a really great... Hold on a second. Can you rewind that? Does he have kinesio tape on his neck?
No.
Go back a little further. When he was walking onto the stage.
Yeah, he does.
He's got K-tape on his neck.
He does.
That's actually not a bad K-tape placement. That's one that can be used to help promote kind of relaxation in the upper traplevator scap muscles. Cervical paraspinal.
Oh, there's some inhibition taping.
Yeah.
More along the paraspinals than it is.
Yeah, more along the paraspinals. Yeah.
But it's okay. I mean...
Yeah. Guys, so important caveat about kinesio tape. We should definitely chat about that. Like, kinesio tape it's not going to fix your problem. It's like a constant tactile cueing, basically. That's what we use it for in PT. So if somebody tells you that they're using KT tape and it's going to hold your joint in a certain place or alignment, you tell them no, it's not. It's designed to give you tactile feedback. It's designed to cue your body to do the thing it's supposed to be doing, or to not do the thing it's not supposed to be doing.
Exactly. I usually tell the people that I tape that it's a way to bring me home with you, to remind you to do certain things.
Yeah, I did like that line. It does seem like he is open to the possibility that he might be able to come back. If my form and my health, if I can recover at my best. Yeah, okay, so here's the thing. Like, that's absolutely an option. At 23 years, you're basically made of rubber at 23. You can absolutely get there. There was something somebody had said that I'd seen, that a doctor had told him he had the hands and wrists of a 40 to 50-year-old man. And I was like, what the fuck doctor told you that? That's how are you measuring that? Are you doing a bone age? Are you doing a HIDA scan? What are you doing here? Because, like, that's... One, there is no standard 40 to 50-year-old hands. Two, if you're talking about, like, /maybe arthritis development or inflammation, like, that's not isolated to 40 to 50-year-olds. And I can't remember whether I said A's or ones. C/3, No, you don't tell your patient your hands are so fucked up that you look like they're 40 or 50 years old. You tell your patient, hey, you've definitely put some extra strain on your hands. Here's how we're going to address it. Because like if you tell somebody you got the hands of a 40 to 50-year-old, that's like a snapshot like that they're going to take with them and they're going to hold on to. They're going to hear, I'm getting too old for this. They're going to hear, I've got no chance coming back from this. It's the same thing like the term pain catastrophizing. In medicine, we use that word to refer to kind of a mindset where when you start to have pain, you structure your belief such that you believe the pain is persistent or really going to be chronic, or you're going to have to deal with this forever, or it's going to be overwhelming and unmanageable. But what patients hear when we say pain catastrophizing is it's a catastrophe. It's terrible. It's the worst. It's the horriblest thing ever. When what I mean is, no, you thinking that makes it the horriblest thing ever.
Exactly.
And so despite the fact that like this term that we know that we would use kind of in internal conversation, there is a shift away from using that and discussing it with patients because it plants thought viruses. It gets people thinking about their injury in a way that's unhealthy and unhelpful. So it's really, really on medical professionals, especially for esports players, to like be communicating at a level that your patient is understanding, right? So it's talking to your player in a tone of voice and with a choice of words that makes it clear, hey, this is normal and expected strain for the amount of work you've been putting in. You have, however, probably been doing a little more work than you needed to and dealing with more strains than you had to because of posture, lifestyle choices, ergonomics, whatever. There are a lot of things that we can do to alleviate that strain. Let's talk about some of them. Let's refer you to someone who can, help you manage some of them. Let's make it as clear as possible that you have autonomy and control here, that this is a thing you can affect and impact and change. When he talks about his medications, for example, it sounds like he's really talking about something that he feels is out of his control. Mm-hmm. It is absolutely essential that any medical professional treating any patient, but especially a young esports player, is making it clear to them the degree of control that they have, especially with these kinds of chronic injuries where you have a massive amount of control. There are so many things you can do to affect and prevent and manage those. There are so many ways. And I guess another thing that giant piece of equipment does is it makes you feel like you're not controlling the getting better. It makes you feel like if I don't have all this, extra important stuff, then I'm not going to get better. I can't do this on my own. As a physical therapist in particular, my goal is to make myself irrelevant for my patient. My goal is for them not to need me anymore. If they don't need me anymore, I've done my job right.
Exactly. I think a really large issue with just medicine in general, especially when they're presented with a gaming injury or a gaming case, is that one, a lot of the doctors don't have time to really get a full in-depth history to understand what's happening, what's going on. But I don't think that was the case here, right? I think very obviously they brought someone in to try to work on this, and I just think that a lot of the times, and I think it's definitely shifting.
Please tell me why is he being put in so much cervical flexion here?
I have no idea.
Why is he doing like a weird Sperling's test in flexion instead of extension? I don't get it. Maybe they're trying to get him to do a chin tuck, but you don't chin tuck like this. You chin tuck like this.
Exactly.
You don't know what you're doing it wrong.
Yeah, I just feel like there could have been so much done to better understand exactly what he was doing for practice. I'm sure that was a part of it. But from what I know in the history of when he took a month break in 2019 and when he took a mini break in 2018, it was that, hey, I just needed to rest. And I think a lot of the times when there's a discussion about, hey, what is this player doing now that he is taking a break, there's not a lot of mention of them really showing that they understand what they need to do to get back to it, right? And that's what I feel like is missing. If the healthcare practitioner is not educating the player well enough so that by the end of their first or second visit, they're able to even explain to a friend or explain to their coach, hey, this is what I'm dealing with. This is what it's going to take to get me back to playing 6 to 8 hours a day. And sort of this is the path that I'm going to be taking. Then how's anyone going to understand more or less even the bigger structures in place, the league, the team, everyone else? If that's not even understood from the healthcare to the actual gamer level, then of course it's going to be made. Yeah, exactly. exactly. It's going to be made into such a big deal because
Like,
at the very root of it, people did not understand how to properly or potentially educate or focus on the right things with the patient. So
I've got 70-year-old patients that I managed to explain adhesive capsulitis to. You can absolutely explain to a gamer why they need to change what they're doing and how you're going to help them change it and how they're going to be able to carry on changing it in a way that makes an impact. If your patient can't leave your session and say, at least broadly, they don't have to be able to explain in depth why you chose each and every single exercise, but if they can't leave broadly saying, yeah, we worked on, my scapular stability so that I have better shoulder control. We worked on the muscles of my core so I have less low back pain. And we worked on some endurance in my forearms so that I can play for longer. If they can't tell you the general reasons why you gave them the exercises you did, then you haven't explained it well enough. Exactly. That is part of your job, to meet somebody.
That is your responsibility, 100%. Yeah. So I think moving on into the next discussion, what do you think that could have happened differently in the beginning? Right? What maybe could have been a better way that he could have approached it? I mean, we obviously discussed a lot throughout this entire process. Hey, he could have had maybe a more thorough assessment of what the contributing factors are. He definitely could have had a better education. Is there anything else that you see that might have been helpful in maybe preventing this from happening? I mean, I think we definitely covered a lot of the big things. Education, 100%. I do think league and teams could have better standards with their health so that they understand and have partaken some responsibility in understanding what is being delivered to the athlete. But then again, I do feel that there's still this big gap in what we know as optimal for treating gamers, and then what I feel like the rest of the world is really implementing currently.
All right. So you were saying, definitely improved health standards in the league. Mm-hmm. Definitely, that's going to require an improved understanding by the support staff and by the league structures themselves. I think that, in all likelihood, the best kind of point of intervention is going to be at the team level as opposed to at the league level. Mm-hmm. I think teams have a closer degree of commitment to and understanding of their players, and they're able to develop more of that trust, more of that rapport, which is so very necessary for any buy-in when it comes to kind of health and performance behaviors. I think, too, making it really clear that not so much that, this is an additional extra thing that our team does, but making it just the baseline expectation of, this is what we do. We're competitive gamers, so we do this. This is kind of resetting what the assumption is about what it means to be a really competitive top tier esports player. Mm-hmm. Making it normal and habitual and expected. And then what goes along with that too is the medical community making sure to meet them there. Yeah. That means, when you see your primary care physician for a wrist injury from gaming, they don't just tell you, stop doing for a while. Rest. No, just resting will resolve the pain, but it'll come right back because you haven't done anything to prevent it all over again. Yeah,
I mean, that's definitely something, even very recently I've dealt with some of the patients that I've been treating online, and that some doctors are even sending some gamers for nerve conduction studies without even a full physical exam.
Why?
And
studies are invasive and painful, and they don't even
and there's anymore. Results showing slight, deficits in nerve conduction for the median nerve, and that gives them ammo to say they have carpal tunnel syndrome. But here's the kicker: the case has only been 1 month. What are you talking about? And then the pain distribution, there's no numbness, there's no weakness. Yeah, and I'm so frustrated so much of the time when I hear this. But I can't blame them. I can't blame them because I think the education is a big reason why this is continuing to happen, and that's why.
You're being more considerate than I am because I can blame them for the education being lacking. I absolutely think that schools need to be making sure that they are teaching the most up-to-date information. I think absolutely we need to have better cross communication between different medical disciplines. Like the stuff that there's stuff that I've learned about hand health because I follow hand health surgeons on Twitter, and we've had really interesting conversations. And they make jokes about PT, and I make jokes about hand surgery, and it's good. It's like a collegial degree of things, and that leads to this ability that when someone who hasn't had a gaming patient before isn't 100% certain of is this serious, or is this more of a kind of lower level thing that we can manage really easily, they feel that they can ask about it. So we really need to create a culture where not just gamers, but other medical professionals feel comfortable asking and know where to look.
Exactly. Refer to the right individual. And it's tough right now because we feel that the gaming industry is growing a lot faster than I feel like our education can keep up with to manage that, which is why I think we're trying to sort of help bridge that gap. Hopefully in the next year or two.
I've been so heartened by how many students, like student PTs, student OTs, even medical students, have been, one, grown up in gaming, and two, been like more and more conscious of there is some connection between the world of medicine and the world of esports, and I can help bridge that gap too. It's really, really heartening to see that, because it does mean that down the line these players are going to get the kind of the treatment that they need when they have the treatment or when they need that treatment. It's like there are fewer and fewer medical professionals that I'm encountering on a regular basis who are like, well, are they really athletes though? And more of them who are like, who the fuck cares? Let's treat them.
Exactly.
Which is
great.
Really because then that creates that degree of trust between the medical community and the gaming community. And when you've got that trust, you've got people actually listening to each other. That means you get doctors actually getting the full history. And then that means you get gamers who are actually understanding what's going on and what's explained by their doctor. I have a 14-year-old patient right now who he came in for an ankle sprain. He was giving me one-word answers, not meeting my eyes. His mom was answering all the questions for me until I asked, what are you doing since you're off from school because coronavirus. And he's like, play video games. And I was like, oh, what do you play? He's like, I play Ark. And I was like, I love playing Ark. I had the hardest time capturing a spiny. And he was like, you play Ark? Oh. And then all of a sudden there's this conversation, and he's interested and invested in his treatment. When it's clear to patients that we understand them, especially our gaming patients who haven't been historically understood by the medical community, they give a shit. They want to get better. Exactly. It's just we've never made them believe that they could.
Exactly. And that, I think, is a good transition to what are the next steps, right? What are the next steps that we can take, maybe specifically for Uzi, but overall in the community as a whole. Although everything that we just talked about is definitely the next step, right? We need to help bridge the gap for the medical community.
Let's take a specific case of Uzi, though, right? Let's say that Uzi's interested in coming back. What kind of things could he do to come back? I think there are two really big and key things for him. One would be he needs to be seeing someone who specializes in exercise. Probably a physical therapist. OT would probably also be a helpful option. It's not just us that can do, kind of diagnostic and exercise-based treatments.
Someone that really understands the gaming community. Someone that really is willing to dig deep and truly understand his schedule on a day-to-day, on a weekly, on a season basis. And then working with the coaches, working up, working down, to really make sure that they're prescribing something that makes sense on those different time periods, so that he can gradually see progress. Not just making a global 4 or 1 month, 2 month recommendation. Just rest and you'll be better. Because that
no, it's got to be something that meets the player where they're at. So in this case, we're saying meet Uzi where he's at, which is, let's take a really solid history. Let's talk about when your pain started. Let's talk about what exacerbates it, what makes it better. Let's talk about, what times have you felt less pain? What kind of behaviors you've been engaged in then? Are there times when you felt more pain? Great. What was different about those particular times? Let's talk about your ergonomics. Let's have a look at what your schedule looks like. Let's find a way to fit the exercises that you need to do within that daily schedule. Let's see if your practice schedule is optimized. And if it's not, in terms of physical function at least, let's talk to your coaching staff about, hey, why are things set up in this particular way? Is there something that I'm missing or not understanding? Because it might often be that. It can absolutely be that we don't understand why their schedule is set up the way it is, and there's a perfectly valid reason for it.
Exactly.
Operating under the assumption that we know absolutely everything or we know best is every bit as harmful as assuming that there's nothing we can do to help. You have to understand where the player is at. You have to understand where their support structure, their team, their family, their friends is at. And then you need to build from there, which is building from the individual player, building around the particular team.
I'm going to make a bold statement, though. I think that with the right care, with the right team of individuals around him, he can return to play in a year. So here's my caveat to that. I think if he wanted to, and he had that support, then yeah, he could absolutely return to play in a year. Exactly, if he wanted to.
Right, and something part of the if he wants to is probably tied up in the if he believes he could. So that makes it a complicated endeavor. But certainly, I think at 23 years old, with the particular injury history that he has, it would be entirely feasible to say he could get back to competing at a really high tier level.
Yeah, and just let me make it clear, right? When we or any healthcare practitioner is working with an individual that has been dealing with pain and has all these high level expectations and has thought viruses, part of our work or part of the healthcare practitioner's responsibility is to untangle a lot of those thought viruses, untangle a lot of those beliefs, to show them that they're capable, to show them that they can gradually build up function. And those lead and are concurrent with actual physiologic changes that occur in their spine, in their brain, and then definitely
the brain is super cool. The amount of overlap there is between physiological and psychological development of the brain is insane. Exactly. There's a reason that kids who have physical disabilities often are perceived as having learning disabilities, when in fact they really don't. They are no less intelligent than anybody else. But we know that there's a huge link in early childhood development with movement and participation in the environment. So if you're less able to participate in your environment, you're getting less stimulus, which affects how your brain changes and grows. When we give kids with developmental disabilities the ability to move, more ability to interact with their environment, we see drastic changes in how fast their brain is developing, exactly on par with someone who doesn't necessarily have a physical disability, which to me kind of really emphasizes the importance of the two things, really. One of movement in general as kind of a thing that has a significant impact, not just on your kind of physical body, but also on your mental state. And two, the importance of kind of self-driven change, which is to say, when we're talking about those kids with physical disabilities, their ability to participate in their environment, if you make them able to move and they move by themselves, they get those benefits. It's not something that you did. It's the fact that they're now able to move, however they got to that point. Same thing goes for our patients who are no longer children, that when you equip them with what they need to do to improve, and they do it, they're not just physically changing their body function. They're also having an impact on how they perceive their ability to deal with stress, pain, and competition. Exactly. And you've enabled that. If a patient walks out saying, you're the absolute best, I couldn't have done this without you, be a little wary of that. You should put your patient in a position to be saying, I couldn't have done this without the work I put in.
Exactly.
And yeah, your patient can absolutely be grateful. It's lovely, it's wonderful, and I enjoy it too. But your patient should absolutely walk out believing wholeheartedly that their improvement is because of the work they put in.
Yep. And I always say that, right? I'm always like, you should be proud of yourself.
Yeah.
Because they should be. They put in the work. I just was like, hey, these are some things that you should do because it's based on the evidence.
Right. We provide education. We provide, the kind of the specifics that only a degree in PT can provide you with. But they provide all the work, and so making it clear that it's not the work that they did that made the changes. It's not my knowledge of the work that made the change.
Exactly.
My knowledge made your work possible. Your work made the change.
So yeah, I think that sums up a lot of the key points that we wanted to highlight with this video, and you know, hopefully you guys learned a little bit about how we think some of these situations surrounding Uzi's case could have been handled, or maybe now how he can move forward. So anyone in Uzi's camp, you know, if you guys are happening to look for anyone that might want to help him, you know, there's a great team of physical therapists out here in NA that would be happy to help and get one of the former best ADU carries in the world back to form. We would be happy to. But thank you guys for tuning in. This was fun.